So, well, my guest on the line here is Dr. New, and you can find out information more about him at newcare.net. So for people who may not know or people who are curious about this term that we say direct primary care, when you talk to people about it, how do you describe, what is direct primary care?
Well, to me, and there's a lot of different variations on the model, but to me, it basically is a patient and a doctor entering into a direct relationship. And so the operative word is direct. And this is kind of hard for the general public and even people in healthcare to think about, because health insurance and health care have become like synonymous. The words have have melded together somehow, and people think that they are mutually dependent upon each other. And what I basically do, and what other people who are doing direct models are doing, is just there's no need for a middleman. So I don't contract. I don't have a single contract with any insurance company. So if patients come to me, it doesn't really matter if they have insurance or not. We have our listed prices up front that people pay, and it's just very upfront. It's really similar to what family doctors did before managed care. I mean, it's really not necessarily innovative in that sense. I mean, I'm not old enough to remember that, but before 1975 or 1980, family docs, country doctors, they didn't contract with anyone except for their patients, and so that's really what it is, and just kind of an updated version of that. So you don't accept insurance, or you don't think you need insurance. So how do patients compensate you for the services that you give them? Well, so what we do is we basically, and again, there's variation in this model, but what I do is I have a membership fee that people pay, and it's $10 or $20 a month based on their age, and people 29 and under are $10 a month. People 30 and up are $20 a month, and that's just an ongoing membership fee, and people get access to me 24/7 by cell phone, email, and then we don't charge for every little thing we do. We do some point of care testing, EKG, stuff that doesn't really require a lot of goods, disposable goods. We just don't charge for that kind of stuff, and we have some medical equipment we let people use. So it's just for those little things that we do. Quick email, quick phone call, it's just not a very efficient way to bill for a minute conversation or, something that costs me 50 cents. So the membership fee covers all of that stuff. And then when people come in and see me, regardless of the, medical issue they may have, whether it's a wellness issue, chronic disease management, acute problem, we charge based on blocks of time. So the way that we do it is $20 per 15-minute block of time with me. So most people's visits are going to be, $20 or $40. And so really, if you think about it, people, most of the time are going to be paying a very similar, price that what their copay is, except for that's, the 100% cost to me. There's no bill later. There's no surprises. It's all up front.
And then, so you can draw some kind of more simple blood work and lab work at your office. Is that right?
Yeah, we have kind of the standard point of care stuff that most strep tests, urine tests, that kind of thing, and we try to do as much stuff in house as we can. But if we need to send people out for lab, because we don't have like a culture counter or a chem machine or anything like that, what we have done is we contracted with a couple different labs, and I negotiated really reasonable rates for lab work. And we kind of, translate that into our fee that we charge people for the lab, and then we send it off to, the hospital or whatever lab service we're using. But the labs are very, very reasonable. We charge basically at cost. So we're not looking to make money on, the lab fee. So if we have an X-ray, or we have the same thing with some radiology centers and that kind of thing. But we basically just become like a purchaser of those things, and we charge near cost, but we translate it, to make it real simple. So, for example, a cholesterol panel is $10. A CMP is $10.
Wow.
$10. Yeah, I mean, like for example, our wellness panel, and this is not the standard. And I'm actually fairly conservative. I don't order lots of tests, but like our standard adult wellness panel includes a CMP, a CBC, hemoglobin A1C, lipid panel, and TSH, and it's $30 for all of that.
Huh.
Yeah. So, and like I said, we're not really making a lot of money on those ancillary things, and that's not, I'm not really in it because I'm not a lab company. So we basically just negotiated really low rates with the lab, and then we just kind of pass along those savings to our patient. It's just kind of a, value-added benefit to them. And what's really funny is we've actually had, we have, most of our patients actually are uninsured. But we do have some insured patients who have kind of a standard insurance, PPO model, and so we've, some people I can order a lab and they can run it, through their Blue Cross or whatever they want, and we've had that happen where I actually, ordered a lab for that same panel that I just mentioned for $30, and I told the patient, if you run it through us, I can tell you it'll be $30 cash today and you'll be done with it. You know what it's cost. If you want to run your insurance to pay for it, that's fine, but I can't tell you what it's going to cost. And so he's like, I have my insurance. I might as well use it. I'm like, okay, that's logical. So I give him the lab order, and they get the lab, and he calls me about a week later, and he's like, you're not going to believe like what my co-insurance for that lab was. And okay, whatever. He's like, it was $37. So in some crazy way, I mean, the co-insurance responsibility was more than our 100% cash price.
But something I'm curious about is, is negotiating with labs and radiology centers. If docs, are need advice on that, what kind of advice would you give to physicians who want to negotiate that type of stuff?
Just be a really annoying fly and just buzz. I mean, it depends. It depends on who you're talking to, because whenever I've called people and kind of explained to them what I'm doing and what I want them to do, and it's a very simple thing. I want you to give upfront prices and reasonable prices, but really, the cornerstone of it is just transparency.
But Ryan, nobody wants to do that. You had to be a
no, I know.
In a nice way. You had to be a shrewd businessman to try to get that.
Yeah, no, it is. It's a very, and what's really interesting about this is my experience actually in residency in a safety net clinic actually kind of helped train me to do that, and I didn't really realize it at the time. But most of our patients at the safety net clinic were uninsured, and 90% probably.
So for people who don't know, that a safety net clinic is basically like a free clinic. Is that right? Or
yeah. I mean, it's like a community health center or a free clinic or whatever.
Okay.
And so, when I worked with those patients, they were mostly uninsured, and so, I mean, I had to know what stuff costs. I mean, and it's kind of this, strange world for most doctors to actually have to think about that. But when I went down, was working with those patients, I couldn't just prescribe whatever cool brand name, high blood pressure med that the pharmacy rep had just told me about, because the patients would come back and say,
correct.
Well, that's great, doc, but it's $180. I can't afford that. Or, I couldn't just order a bunch of labs because I was just curious, because I had to know how much they cost. And so, I got exposed to that side of things and kind of, learned, like, how much does a CT cost? How much does a chest X-ray really cost? How much does, these supplies cost? And because we really had to be, we had to be really cost conscious in that setting. And so, doing that, and I kind of learned about, just the general, way that people price things. I mean, it was a really good starting point. And then pretty early on, I just, started making phone calls. And some people aren't receptive to it at all. I mean, some people just, but sometimes when you describe it to them, how it works and what the benefit is for them, like I have with a lab company, I mean, it's amazing because, I mean, it's easy for them too. I mean, they basically, I have an account with them and I pay them 100%, upfront. There's no, coding, there's no arguing, there's no denied claims. It's just, it's straight cash at the end of the month for them. So, but yeah, it's really, really hard. I mean, I've had a lot of trouble, with trying to find, upfront prices with other doctors. I mean, quite frankly, the ancillary stuff, labs and radiology, the technical stuff, has been a lot easier to negotiate. But we've done a pretty good job at it. I mean, I'd like to expand those services because I think that's going to be really necessary to make this kind of direct model work, because I can't buy a CT scan. I can't, buy all this, fancy lab stuff. And we'd like to get more stuff as time goes along, but, we really have to have kind of those basic ancillary services available to us. because if you just send people to the hospital, I mean, it's going to be, an outrageous charge. But it's been a struggle for sure, and that's honestly become a big part of my job. Is trying to figure out, okay, I can't perform this thing for this person. Where am I going to send them? So I spend a lot of time on the phone talking to, places around my community.